and on YouTube. We're talking, of course, about the only news story of any significance anywhere, and that is the coronavirus outbreak. And it's a very dismal news most of the time. And as you know, I try to balance it out as much as possible with some optimistic information. And sometimes it's hard to come by, quite frankly, because while the percentages might suggest flattening out or decreasing in the increase of death rates and the percentage of mortality, and you might say right now in the United States they're figuring a 2.9% mortality rate, and that doesn't sound very significant, but when you talk about sheer numbers, then it gets kind of scary. But I think it's really important to balance it out with some positive information every once in a while. And we're very lucky to have with us as our guest Dr. Randall Lipsher, who has some positive information, but it's not completely positive because the good news actually isn't really being implemented. As I understand it, and Dr. Lipsher is a professor, an associate professor at the University of Texas of emergency medicine, and he's a practicing emergency room doctor. So he's not one of those who teach but don't practice. He actually practices his craft. So he's right on the front lines of all this. And Randy Lipsher, first I want to welcome you to this chat on Facebook and on paltalk.com and on YouTube. And I want to ask you about a medication that you kind of almost stumbled upon that can actually save the lives of some of the most critically ill people with the new coronavirus. And welcome.
Thank you. I appreciate the opportunity to be on your show, Gary. The medication is called Giapreza. It's made by a little biopharmaceutical company in California called La Jolla Pharmaceutical Company. And about 3 years ago, I was reading an article from the FDA, and the chairman of the drug discovery area remarked that a new medication called Giapreza was coming to market, and that it was able to save about 14% of people who had sepsis who ordinarily would die. So sepsis is blood poisoning, and that's exactly what people with coronavirus are getting. And so this medication is able to save about 14% of those people who will die. And that's potentially an enormous number. And it's enormously helpful to the medical community.
And in fact, you told me anecdotally, and I think it bears repeating, this wasn't a coronavirus patient, but you had a patient that you thought you were losing there on the table in the emergency room, and you used this drug. Can you tell us a little bit about that?
Yeah, it was a young Black female. She was about 30 years old, and it was in Aiken, South Carolina. I was practicing there. I traveled around the country to practice, and she had some type of pelvic infection that was treated the week before, and she was not doing well. She came back to the emergency department, and one of my physician assistants went to see her, and he came to me and said, "Dr. Lipsher, can you please go into the room? Something's not right." And I went into the room, and she was in cardiac arrest. So we started CPR and pulled her into the code room, and I intubated her, put her on a ventilator, and I put a central line in her, and I started giving her fluids, and her blood pressure was not coming back. Her blood pressure was not measurable even. And then we started high dose norepinephrine, which is a medication that we use to get people's blood pressure back. And that wasn't working. Her blood pressure was 60. A normal blood pressure, is like 120 over 80. Her blood pressure was 60 over nothing. And she was not responding. She was dying. And I remember that article that I had read. And I called the hospital pharmacist, and I asked the pharmacist, to please bring down Giapreza. Thank God this hospital was forward enough to have the medication, and they brought it down very quickly. It was in within about 3 to 4 minutes. And we started her on this medication, and it was a miracle. That's all I can say. It was an absolute miracle. Within about a minute, her blood pressure was 120/80. It was incredible. I've been practicing for 25 years. I practice with people who are critically ill all the time, and I never have seen that. Never.
So, a miracle drug, at least in the case of your patient, but she was not suffering from the coronavirus. So,
She was,
can you tell us how it applies? Why the Giapreza? Am I pronouncing it right? Giapreza is
yes.
is able to help patients who are critically suffering from the coronavirus as well.
So she was suffering from something called septic shock, which was blood poisoning. And
Yes.
that's exactly what people with coronavirus have. So what happens, people with coronavirus get virus and it enters their bloodstream,
Yes.
and it allows bacteria and other microbes to enter their bloodstream, and the viruses and the bacteria cause the patient to go into septic shock. Sometimes it's just the virus, but it does exactly the same thing. The virus causes this immune response where the body relaxes the blood vessels, and what ends up happening is the person cannot hold their blood pressure up, and that is how they die with coronavirus. It's not for lack of oxygen, although that's important. It's their blood pressure bottoms out, it goes away, and this medication fixes it. In about 15% of cases it fixes it, and it's just incredible. I just, like I said, I've never seen anything like this.
Not only does it fix it, but it does it instantaneously, which is pretty amazing.
I'd say within 60 seconds. That's what I saw. I was flabbergasted. I was absolutely flabbergasted at what I saw.
Now, if this works so well, and as I understand it, in hospitals in several countries that are inflicted with the coronavirus, it's in general use. And while it's not 15% or 17%, is certainly not a panacea. But if you look at the number of people getting the coronavirus, as I said at the beginning of our discussion, percentages, it may seem not like a lot, but that's a lot of people. Maybe you figured out how many people we would potentially be saving with this in the United States.
Well, it depends on how badly the virus hits us. It looks like it's going to be actually quite bad. If you imagine that, the CDC originally estimated that, 150,000 to 250,000 people might die. The World Health Organization estimated the death rate to be worldwide to be somewhere between 150,000 and 15 million. If you imagine that 15 or 1 million people in the United States die, which I think probably is a low estimate at this point, this could save 150,000 people. And but we need to use it, and it's not being used.
And now we get to the real important part of this interview, in my opinion. Why is it not in use in the United States of America if it could save so many lives?
Well, I think it's pretty simple.
Okay, I'm losing your sound a little bit here. Your internet connection at the University of Texas must have just gone south a little bit, but try again.
So the problem is I believe the hospitals are trying to save money. This medication costs, a couple $100 more than the medications they would normally give, and they have these committees of bureaucrats. They're pharmacists and bureaucrats, and they decide they want to save money. And so what they're doing is they're preventing, or they're recommending to the hospitals not to have this medication on board. And then that's number one. And then they're telling the physicians, they're telling us that we can only use this medicine as a last resort. And because of this, people are dying. And I see this all over the place because I travel from one hospital to another. And I've wanted to use this medication on numerous occasions in different hospitals, and the hospital doesn't have it. And the reason the hospital doesn't have it is the hospital is trying to save money. and they're basically putting profits over people. And that's especially true in New York. I mean, you have two major medical centers in New York which do not have this medication on board. One is New York University, NYU, and the other is Hackensack Medical Center. They've refused to stock the medication. They've refused to stock it. So if you happen to have coronavirus and you're sick enough to go to the ICU at NYU or Hackensack Medical Center, you have about a 15 to 20% greater chance of dying than if you go to another area hospital. I mean, it's absolutely tragic and it's unethical.
So the guest is Dr. Randy Lipsher, and the drug, as many people are asking the name of the drug over again, is Giapreza. That's Giapreza. So as I understand it, it's about $100 a dose, but you only give it once, and the patient then will either recover or will not, because you're talking about somebody who at that moment may be terminally ill.
It actually,
yes.
It actually, in their studies, they found out that they normalized blood pressure about 70% of the time versus control, which was about 28% of the time. So it works about 70% of the time immediately. Wow. Yeah, it's absolutely, if you saw this, Gary, you would be like, oh my God, I can't believe this thing exists.
Yeah, I can just imagine that if my loved one is in the hospital and I say, can you give this to my loved one, save their life, please do something. And they say, we can't do it. It costs $100 to do it. I mean, I reach in my own damn pocket and here's the money, do it. I don't understand this.
It's ludicrous. Again, these hospitals are putting profit over people. It's as simple as that. This is the only FDA approved medication that's helpful for coronavirus. Let me repeat that. It is the only FDA approved medication that works for coronavirus. The other stuff that's out there, you've heard about the malaria drugs. We don't have any scientific evidence to indicate that stuff works. We know this works. This is being produced in the United States. In fact, the Europeans are all asking for this. This is being sent over on an emergency basis to Italy, to Germany, to England, and they're using it and they're reporting, from Twitter that this is working. It's working and it's helping a great deal. I mean, what do you have to do? I'm from Texas. You live in the New York area. My God, if you're the CEO of New York University, do something. If you're the CEO of Hackensack Hospital, do something. Fix this. Get this to the patients that need it. Save the patients.
I have a question from the audience. What does the doctor think of what's it called? Hydrochloroquine, the one that the president is trying to push so hard?
It's unproven. We don't know anything about it yet, other than there are some basic lab studies that show that medication in combination with zinc seemed to help eliminate the virus from cells. However, that's a big difference doing an experiment in a test tube. It's a big difference from doing it in the actual clinic. And that just has not been proven. Anthony Fauci said that yesterday. It's not a proven treatment. So if you want to try it, sure. But is it going to help you? Who knows?
Who knows? But we do know that this is a successful treatment. It may not be, as I said, a panacea, but it certainly can save a lot of lives. And I'm hoping, Dr. Randy Lipsher, that this goes beyond this audience and is heard by the president or Governor Cuomo in New York State, who is really the one who I think from a political standpoint is taking the lead on all this as a matter of necessity, because we here in New York State are the epicenter of all this in the United States. And somebody get on their bully pulpit and demand that this become available to patients in hospitals all across the United States. Now, I'm not saying this from the perspective of a medical professional. I am not, but you certainly are, and you've seen it work right before your very eyes.
You don't have to be a medical professional All you have to be is somebody who cares about other people to know that we need to use this medication. We need it available. And they can't tell doctors that they have to use everything else until the patient is on death's doorstep before we can use this. We as doctors need to be able to use this medication and use it when we think it's clinically necessary. There's theoretical evidence to believe that this medication may be more effective than some of the current medications that we use to keep people's blood pressure up. But really, for the hospitals, it's just a matter of money. They want to save money. Okay, great. If you did this with my father, I would be just so unhappy with you.
Well, like I say, I'd be happy to reach in my own pocket and pay if it was my loved one or even my neighbor, or even a stranger for that matter. I'm not being altruistic. I just believe that, everybody in a time such as this, we have to give up a little something. There are whole businesses that are closed that some of them, I've talked to a lot of small business owners, probably will not be able to reopen. They really are concerned about that ever. And for the hospitals not to do their part, I know the frontline folks like yourself, the doctors, the nurses, the technicians, I realize you're actually putting your lives at risk every single day, but the hospitals have to contribute a little bit here too and put this on the protocol, in my opinion, based on what you as a professional are telling me. And, my audience knows I tend to not give my opinion on a lot of things. I try to be the arbiter of facts. If you give your opinion on something and it's factually incorrect, I will hold you to telling the truth, because I want to make sure that whoever's listening on any format that I provide is accurately informed. But it's very rare for me to say what I'm saying right now. You're a little bit emotional about this. I'm a little bit emotional about this, but I think for great reason, Randy Lipsher.
I just hope that Governor Cuomo, Governor Murphy, and President Trump look at this. And look, they are all reasonable people. And a reasonable person would say, let's get this in place so the doctors could use it. It is really at the same level as a ventilator.
So as we close, I just want to recap. The name of the drug is Giapreza. I'm saying this for people who are just joining us. Giapreza. The guest is Dr. Randy Lipsher. He is an associate professor of emergency medicine at the University of Texas. And I know you want to be in the ICU behind you there, taking care of people. I'm going to let you go and do that. I appreciate you taking this time out because I think it's very important, as obviously you do, to inform the public. And thanks for joining us today.
Thank you very much, Gary.
And for those of you who are on Pal Talk, stand by. I'll be with you momentarily to continue this conversation. And for those of you who are on Facebook and on YouTube, it's paltalk.com, a free download. It's a Pal Talk Global Newsroom. And until the next time, we are all together. And with my thanks to Randy, I say, as I always do at the end of these little discussions, please stay safe and peace out.